So next up is passive. So just move ever so slightly towards this side of the bed, thank you, making it slightly easier for me. So we're going to go into passive flexion of the hip. So we're going to hold underneath the knee and onto the ankle, just so we've got maximum support. They need to be relaxed, so therefore we need to be taking good control of their leg. It's no good kind of just trying to point with little fingers, because they're going to contract and stop you, and they should be completely passive. So you want nice, decent support. So we start to bring that up there, move our hand back on top so that we're not going to get in the way with our hand underneath. Hand comes on top there. We start to bring it up and keeping an eye on this leg here. So as we start to come up, the pelvis can start to rotate, and we want that flat down there. And then I'm going to use my shoulder and chest to pull that in. I need to keep an eye on his face to make sure to see if it hurts at all, as well as also looking back at that leg. So if I just show you here, you can see that leg just starts to rise. So we're getting to the end of range. Okay, so we apply our pressure and our overpressure, seeing how it feels, and then we're going to come back. Okay. Okay, abduction, adduction. So passively we can't add any overpressure into adduction, only abduction. So we need to take them from this adducted position here. And remember, we need to control the positioning of this foot. We don't want that foot rolling out again. To achieve that, the hand comes in from the outside, underneath and round the underside of the knee. With the pelvis, we also want to stabilise and make sure that they're not rolling their pelvis over this way. So to do that, you need your hand on the ASIS. So Neil, are you happy with me just rolling the shorts down slightly, just so I can get to the very front of your hip here? Yeah. Okay, so there we are, there on the front, and this hand's going to come underneath and round. So I'm supporting in my forearm and elbow, holding onto the knee so that I can try to keep that leg in the right position for what I want to achieve and stop it from rolling out towards me. So here and here, just nice and relaxed for me, and I'm going to take your leg out. So keep an eye on that foot, seeing his reaction, and there we have our overpressure. Okay, bring it back in. Medial lateral rotation. So we're going to pull up 90 and 90 again. Two different positions for this, two handling positions. One, we can just support at the knee and holding at the heel. And what we can do is we can take the foot round here into medial rotation. And then as we come back in, coming into lateral rotation. Some of the slight issues with this could be just stressing the knee joint a little bit, especially if they've got a sensitive knee, or if there's any laxity in there. So an alternative method, rest it on your forearm, supporting around the knee, and you try to apply a lot of the pressure here, and only some of the pressure here. So again, we can come round, and then all the way in. Depending upon how much range they have would depend upon which side I would stay to. If this leg started coming round here, if I saw that in the active, then I would actually do it from that side. Okay? So then we come all the way round to here, and don't forget to then come back to end of range there. So it's end of range at the two extremes.